This video provides a high-level overview of the local health system sustainability project support for USAID's global response to the COVID-19 pandemic between March 2020 and September 2023. It also demonstrates the functionalities of 3 user-friendly dashboards that allow us to explore LHSS's responsiveness and compare diverse health system needs throughout the COVID-19 pandemic. To provide a bit of context, LHSS supported the development and implementation of USAID's global response to the COVID-19 pandemic in 11 countries in Latin America and the Caribbean, the Middle East, Central Asia, and Southeast Asia over 4 years. As you can see here on the map, these countries included Peru, Colombia, Jamaica, the Dominican Republic, Jordan, Uzbekistan, Tajikistan, the Kyrgyz Republic, Kazakhstan, Laos, and Timor-Leste. All work was carried out in close collaboration with national actors, responding to areas they identified as needing support. This map also displays the distribution of USAID funding for COVID-19 provided through LHSS. Between March 2020 and September 2023, LHSS through USAID secured about $59.8 million in funding for COVID-19 response from sources such as the American Rescue Plan Act and other mechanisms. And if we take a closer look at the map and hover over each country, we can see the amount that each received in support of COVID-19 activities. Throughout the pandemic, LHSS supported countries' emergency response and strengthened local health systems' resilience to detect, mitigate, and respond to future pandemic threats. As you can see here in the bar graphs on the right, the activity supported a range of interventions to help meet various countries' needs and priorities throughout the pandemic. If we take a closer look at the bar graphs, we'll notice that LHSS's COVID-19 activities largely focused on supporting local actors' efforts in distributing COVID-19 vaccinations and health communications and strengthening health workforce capacities. Country bars with more colors, such as Tajikistan's, indicate that LHSS supported a broader range of COVID-19 interventions in one country. And if we hover over each of these bars, we can see the indicators and their values for each country. So for example, we can see that Tajikistan focused largely on COVID-19 vaccination, with the largest indicator being over 9.8 million vaccine doses procured and delivered. Additionally, LHSS heavily invested in capacity strengthening efforts throughout the pandemic, helping to train healthcare workers in topics such as COVID-19 vaccination, surveillance and rapid response, and infection prevention and control /WASH, among other topics. The activity also provided technical assistance to facilities in areas like case management and supported the procurement of resources such as diagnostic tests and supplies. Now, as we transition to this second dashboard, we'll be able to explore how LHSS's COVID-19 activities evolved over time. Before we begin examining the charts, I just want to provide some context for the different filters. The 2 drop-down boxes on the left allow us to filter by country and year. We can select one country or multiple countries if we're interested in seeing results for an entire region. The 2 filters on the right allow us to toggle between different categories and measures. We can examine patterns at the most granular level by selecting indicator, or we can select result area to take a higher level look. When result area is selected, you can hover over each portion of the tree map to see the indicators that fall under each result area. Finally, we can toggle between 2 different measures. The first is total value, which provides the actual value of each indicator or result area. So for example, here we can see over 10.5 million vaccine doses were delivered throughout the activity's COVID-19 response. Alternatively, we can select number of times reported, which refers to the number of times an indicator or result area was reported as part of the activity. For example, we can see here that the activity collected and reported data on IPC WASH training 42 times between March 2020 and September 2023. We can use these filters to explore how LHSS's COVID-19 response evolved over time. If we look at the tree map by year, we can see that LHSS's COVID-19 response became increasingly complex over time as additional countries became involved and brought a wider range of needs and priorities. Though health system strengthening was a foundational part of LHSS's response throughout the pandemic, the way it manifested also changed over time due to the evolution of COVID-19. So for example, if we look at FY20, we can see that the most commonly reported indicators were related to topics like case management, COVID-19 testing, and infection prevention and control. In FY21, we see a similar focus on case management and infection prevention and control, but we also start to see additional areas gaining traction like risk messaging and training on the COVID-19 vaccine. In FY22, we see an even greater change as indicators related to COVID-19 vaccination continue to grow. And then in FY23, we see a large shift in focus to COVID-19 vaccination and the development of policies and protocols to really institutionalize some of these changes. Now, as we transition to our final dashboard, we'll be examining the trend of LHSS's COVID-19 activities over time. As you can see on the top, we can filter by country and toggle between the two different measures that we discussed on the previous dashboard. Additionally, the two filters right above the line graphs allow us to examine the trend of specific indicators or result areas in more detail. The indicator filter corresponds to the line graph on the left, while the result area filter corresponds to the line graph on the right. So for example, we can look at how the value of a specific indicator, like the number of health workers who received IPC WASH training, changed over time. Similarly, we can take a higher level approach by looking at trends in result area rather than indicator. For example, training on IPC WASH falls under the infection prevention and control result area, and we can see here that these activities were most common in FY22, which was the year when most LHSS COVID-19 activities took place. And just a quick note here, since our units of analysis vary widely across indicators and result areas, the y-axes will change depending on the indicators or result areas selected, so be sure to pay close attention to that as you're using these dashboards. Overall, this data flows logically with the trajectory of the pandemic. In most cases, emergency response activities were concentrated in the early stages of the pandemic and were supplemented or replaced by efforts to institutionalize capacities and strengthen resilience against future pandemics or health shocks during later stages of the pandemic. This concludes our dashboard demonstration and high-level overview of LHSS's support of USAID's global COVID-19 response. But we invite you to continue exploring your potential areas of interest by interacting with the dashboards on our website.